Well, first thing about healthcare. So one of the things I wanted to take a look at was healthcare, and I had to take a look at it from several different angles because I'm talking to doctors, and one of the things I saw a lot about was the commonalities between doctors and pilots on how we do something. And I was talking to Mark today, and one of the things he said kind of triggered me, is that somewhere early on in our lives there was a spark, there was a catalyst that set us on this intense course of study and practice. And then the other part of it I understood is that whether you have a stethoscope or a control yoke, people actually place their trust in their lives literally in our hands, and so are their futures as well. The other thing is our successes, no matter how intensely achieved and actually kind of taken for granted in some areas, they are considered commonplace and expected, as they should be. You know, our judgments, sometimes that are made in a matter of seconds, if not milliseconds, can be sometimes scrutinized for years within the court systems. The airline pilot industry, even the airline pilots, they have always been in an industry that has been highly regulated, highly licensed, extremely taxed, and constantly reviewed. But even with all the paperwork and the red tape and the regulation, I truly believe it is going to pale in comparison to the governmental intrusion and the governmental control that is about to befall your profession. I am truly concerned about the futures of physicians in this country because you are inescapably linked to the well-being of this nation. When we talk about healthcare reform, we're actually talking about three related items, but yet they're distinctly different. We're talking about accessibility, affordability, and quality of care. But when you talk about these three items and you compare them to Obamacare, you cannot see any correlation to anything that Obamacare is actually improving. Because when the government adds 30 million people and subsidizes them, I really don't see how that controls costs. Somebody is going to have to pay for that. That somebody is you and me and the 53% of other Americans who actually pay taxes in this country to the tune of $500 billion. That is what it is going to cost us. The brass tacks of it is this. If you're a working American, your health care costs are going to increase because demand will go up when 30 million Americans have the price of free health care. If you purchase your own personal health care, your costs are going to go up because you are going to have to compete with 30 million Americans that come to the table with a government check. The other rhetoric we like to hear is the quality of care. Well, that is truly ringing hollow to our millions of seniors, our moms and dads, who are going to suffer under Obamacare because of a $500 billion initial cut on Medicare. So, what's my plan? What am I going to do? Well, one of the first things I'm going to do is listen to you, because I'm hoping that you will help guide me in the accomplishments that I wish to do. First thing that I see we need to do is we need to cut the health care costs in a meaningful and timely way, and we're going to have to do that through tort reform on a national level. In talking to OBGYNs and talking to emergency room docs, it is absolutely exorbitant the amount of money that they have to spend on malpractice insurance. That is one heck of a lot of babies and sutures to pay for that bill. Now, of course, we have to take care of the patients that actually suffer some type of malpractice insurance or malpractice. We have to take care of their health care costs, and we have to make sure that they're covered for reasonable losses. But we also have to be sensible. We have to be sensible because we expect you to then suit up and engage once again and put your license on the line every time you walk into a hospital, every time you walk into a clinic, or every time you walk into an office. That is what we're expecting from you. And one of the first things we will see by doing this is we will see the lower costs just strictly related to malpractice insurance. But the other part that we're going to see is we're going to see lower costs because of the tests that are routinely asked for just in the case of defensive medicine. The other thing I'd like to do is drive down healthcare costs by increasing the amount of competition in nationwide of healthcare agencies. By allowing each state to increase competition, allowing competition within the state, we can definitely drive healthcare costs down. That is one of the prime reasons that I think that we can do to drive down the healthcare insurance costs. But we also have to allow the consumer to make choices as well. Another thing we need to do is go ahead and allow consumers to pool their buying power and to be able to purchase the type of health care insurance that they can afford. If they want to go ahead and purchase a vehicle that is going to cover everything from acupuncture to chanting, we should allow them to do it. We all believe in free market economies. We believe in the free market. We understand that the alternative does not work. Even in the UK this week, they have recognized that their system is unsustainable. It's failing. That is what we can take notice of today to make sure that we do not make those same mistakes. The other thing that we need to count on are the doctors here. To make sure that you stand up, keep on fighting, keep on telling us, present us with facts and figures so that we can always be that great nation, that beacon that the rest of the world comes to when they do in fact need that specialized medical care. We can do this. I believe we do need healthcare reform in cost, and we can always improve in quality. I do not believe we may have to repeal the Obamacare, because I have to believe that the federal courts in this country will strike down a law that usurps the enumerated powers of the Constitution. I doubt very seriously that our founders ever thought that there would be a day where the condition of being a citizen of this great nation would be prerequisited by purchase of a product. We talked about a lot of things here today, and there's a lot of more things to talk about. And I do appreciate your time, and I hope you understand this. I look forward to serving the people of the 8th District. Thank you.